Hi everyone, how is your exam preparation? Here I am with the another video of exam preparation of third year GNM, Midwifery and Gynecology subject. For your third year GNM exam, you will be having Midwifery and Gynecology. So in the syllabus, you will be studying Midwifery and Gynecology as two subjects. So the Gynecology, you will be studying about the disease conditions and the disorders. In the Midwifery, you will be studying about the normal labor, puerperium and the care of newborn. So you will be having a 75 marks question paper, and we will be seeing about that question pattern. The first 1 to 4 questions will be about give the meaning questions. In that you have to give the meaning about that particular word. So it will be giving 1 mark, and the next question pattern will be filling the blanks. In that you have to write the exact word which will be missing in that sentence. There is no need to repeat the sentence in your answer booklet. The following is the short notes. In that you will be having 5 marks. So you need to write the introduction and the following contents. You can write 3 to 4 pages in that. And later you will be having a long essay. It will be carrying 7 to 10 marks, and you will be having 3 to 4 long essays in a question paper. So you need to write 5 to 6 pages in that. The next question pattern will be true or false. In that you will be having 1 mark, and you have to state is the statement is true or the false. There is no need to write the statement. You have to just state that it is true or the false. Next we will be discussing about the unit wise question patterns, and in that we will be seeing about the important questions, and it will be helping for you to get the better marks. So the first unit will be the introduction. In that you will be studying about the scope of midwifery, trends of maternity services in India. This will be giving 5 to 10 marks for your examination. So the unit 2 will be reproductive system. In that you can expect for the female pelvis. It will be helping for your practical examinations also. The next third unit will be about the embryology and the fetal development. In that you can expect spermatogenesis, implantation, placental abnormalities and the fetal circulation. In that you can expect 1 mark as well as short notes. Next, fourth unit, normal pregnancy and its management. In that you can expect minor disorders, preconception care, and it will be for 5 marks or for the 2 marks. Then next unit 5, normal labor and its management. In that stages of labor, episiotomy, signs and onset of labor. It will be for long essay as well as for short notes. The sixth unit is management of newborn. In that Apgar scoring, breastfeeding, minor disorders of newborn you can study, and in that you can expect 5 marks as well as the 1 mark questions. Seventh unit is about management of normal puerperium. In that you have to study about the postnatal exercise and the family planning, and it will be asking for 10 marks as well as for the short notes. Unit 8, management of complication during pregnancy. In that you can expect bleeding disorders in pregnancy, eclampsia, pre-eclampsia, intrauterine growth retardation. It will be for short note as well as for long essays. Ninth unit, management of high risk labor. In that you can expect contracted pelvis, cervical dystocia, precipitate and prolonged labor, cord prolapse, amniotic fluid embolism, obstetric shock and PPH. PPH means postpartum hemorrhage. So these will be asking for long essays as well as short answers, and you can expect for 1 marks also. Unit 10, management of complications of puerperium. In that you can expect puerperal sepsis and breast abscess. You can expect for 5 marks as well as for 10 marks. 11th unit, high risk and sick newborn. In that you have to study about the RH incompatibility, LBW or low birth weight, congenital anomalies and caput succedaneum. 12th unit, obstetric operations. In that you have to study about the forceps delivery, destructive surgeries, manual removal of placenta. You can expect for 5 marks as well as for the long essays. And 13th unit, drugs used in the obstetrics. In that you have to study about the oxytocin and tocolides. It will be for 5 marks. Then next last unit is the 14th unit, ethical and legal aspects related to midwifery. In that you have to learn about the mother and child tracking system. Till we have seen about the midwifery nursing, next we will be moving to see about the gynecological nursing question pattern. In that first unit is about the introduction. In that you can go through the terminologies. It will be helping for your give the meaning. The second unit is puberty. In that you have to study about the menstrual cycle and dysmenorrhea. You can expect 5 marks for the menstrual cycle as well as for the long essay. Then the next third unit is fertility and infertility. In that you can expect only give the meaning or short notes. It will be fertility and infertility. Fourth unit is pelvic infections. In that you have to learn about the trichomonas, sexually transmitted diseases and HIV. You can expect this for 5 marks. Unit 5 is the gynecological disorders. In that you have to study about the fistula, cyst, fibroids and the uterine polyps. You can expect for the 5 mark questions in this unit. The sixth unit is breast disorders. In that you have to study about the breast engorgement as well as the breast abscess, and you can expect for short notes. Then the seventh unit, menopause. In that you have to study about the hormonal replacement therapy, and you can expect that for short note as well as for the long essay. So I have discussed about the unit-wise question papers of midwifery and obstetrical nursing. I think it will be helping for your examinations. Don't stick on this part, only these question papers. You can try to complete the whole syllabus. If you are having any doubts, you can ask in the comment box. Best wishes for your examination. Thank you.